I did my presentation on the health benefits of drinking coffee, the past, present, and future. Coffee culture. Most people begin their day with a cup of coffee for an early morning boost, so it's not surprising to learn that 400 billion cups of coffee are thought to be consumed every year. Since it is and has been a popular beverage for a long time, the benefits have been a controversial subject for researchers, scientists, and the public. In this presentation, and in the research, a cup of coffee that is being referred to is an 8-ounce cup consumed black, without the creamers and added sugars. Let's first start off looking to past headlines about coffee's benefits and risks. Coffee headlines in the 1600s through the 1900s. In the 1600s, coffee causes impotence but cures alcoholism. 1700s, coffee helps you work longer. Fast forward to 1916, coffee stunts your growth, and in the 70s and 80s, coffee is as serious as a heart attack. Recent research finding on benefits of drinking coffee. Coffee may lower the risk of developing type 2 diabetes. Coffee may prolong the effects or even protect from Alzheimer's. Coffee may lower the risk of developing Parkinson's disease. Coffee may lower the risk of cirrhosis and/or death by cirrhosis, and coffee can help burn fat, and it may have positive effects on depression. And now we will go over them in detail. Coffee and type 2 diabetes. First and foremost, coffee may lower the risk of developing type 2 diabetes. This disease is marked with elevated blood sugar levels, insulin resistance, and the inability to secrete insulin. Some symptoms include polyuria, polydipsia, blurred vision, and fatigue. New research has found that consuming coffee can increase plasma levels of SHGB, which is the protein sex hormone binding globulin. This protein regulates biological activity of estrogen and testosterone, which is shown to play a role in the development of type 2 diabetes. Studies have shown that people who drink more coffee have anywhere from a 23 to a 50% less risk of getting diabetes. Participants from 3 studies who upped their coffee consumption by more than 1 cup a day over a 4-year period, their risk went down another 11% compared to the people who didn't change their consumption by 1 cup a day. Coffee and Alzheimer's. Coffee may prolong the effects or even protect you from Alzheimer's. As of right now, there is no cure, and it can affect people over the age of 65. It is a progressive and irreversible brain disorder that slowly over time impairs thinking and memory skills and leads to the inability to perform simple daily tasks. One benefit of coffee against Alzheimer's is that coffee is shown to have positive effects on brain inflammation in adults 65 or older who had higher levels of caffeine in their blood. Caffeine also blocks receptors in the brain that lead to the buildup of the protein tau, which is present in brain scans of patients with Alzheimer's in large tangled amounts. These entanglements can lead to cognitive decline and brain inflammation that leads to the death of brain cells. Coffee and Parkinson's disease. Coffee may lower the risk of developing Parkinson's disease, which is a progressive destruction of dopaminergic neurons in the midbrain, which cause the slowing down of motor functions, muscular rigidity, resting tremors, and postural reflex impairment. It is also like Alzheimer's, which there is no cure, which makes finding a prevention that much more important. And now some studies have shown that the risk of developing PD is decreased from a 32 to 60% in coffee drinkers. Individual studies have even found a strong risk reduction, up to 80% with the intake of 4 cups of coffee a day. So caffeine is essentially working against the adenosine A2A receptors that are located with D2 dopaminergic receptors in the cerebral region of the brain. This region is involved in the regulation of locomotion and movement, And so the blockade of A2A receptors increases motor activity and improves motor loss. Coffee and cirrhosis. Coffee may reduce the risk of cirrhosis and/or death by cirrhosis, which has no known cure and is responsible for more than 1 million deaths a year worldwide. It is also a progressive disease that develops and slowing over time, and if continues on, will lead to the buildup of scar tissue that can block the flow of blood to and from the liver and eventually stop liver function. A published study with a total of more than 430,000 participants concluded that drinking 2 additional cups of coffee per day was linked to a 44% lowered risk of developing liver cirrhosis. Drinking coffee is also linked to a decreased risk of death from liver cirrhosis by 66%. How coffee and its hundreds of chemical compounds are responsible for protecting the liver are still unclear, but coffee does, however, contain compounds with anti-inflammatory properties and antioxidant effects, which may and probably do play a role in its reduction of cirrhosis. Coffee and burning fat. Coffee can help burn fat, and caffeine is found in most fat-burning supplements, so it's no surprise that it is one of the very few natural substances that has been proven to help burn fat. Studies show that caffeine increases burning fat by 29% in lean people and 10% in obese people. Caffeine in coffee can aid in mobilizing fat from fat tissue. The nervous system is stimulated by caffeine to communicate directly with fat cells and order them to break down fat. Caffeine also increases the blood levels of the hormone epinephrine, known as adrenaline. The epinephrine makes its way through the blood to the fat tissues and ultimately signals the breakdown of fats that releases them into the blood. The fat in the blood is now useful fatty acids and is mobilized from fat tissues. Moore and Coffee and Burning Fat says coffee can also increase metabolic heart rate by 3 to 11%. So if our metabolic heart rate is higher, then our ability to lose weight is easier because we are burning more fat from the food we eat. Coffee can also boost and improve exercise and athletic performance by 11 to 12% on average. A better workout means more fat burned faster. Unfortunately, they found that prolonged use of coffee makes the body tolerant to boosts in metabolic heart rate and increase fat burning. But the good news is that coffee can still help curb appetite and help individuals eat less. Coffee and depression. Drinking coffee can have a positive effect on depression, and some medical studies found that caffeine can reduce the risk of depression when individuals increase their daily consumption of coffee. Ingredients in coffee, including ferulic acid, chlorogenic acid, and caffeic acid, can reduce inflammation of nerve cells in the brain of patients suffering from depression. These antioxidant and anti-inflammatory properties of coffee can alleviate some distress and discomfort related to the inflammation caused from depression. One study done at Harvard in 2011 concluded that women who consumed 4 or more cups of coffee a day had a 20% lower risk of becoming depressed. Another study done found out of 208,424 people, those who consumed 4 or more cups a day were 53% less likely to commit suicide. Although coffee can have a positive and protective effect on depression and those with depression, it is not a cure, and those experiencing depression or thoughts of suicide should seek help and support. These are some essential nutrients in coffee. Pantothenic acid, which is vitamin B, manganese, which is an antioxidant, riboflavin, vitamin B12, potassium, magnesium, and niacin, vitamin B3. Also noted that both caffeinated and decaffeinated coffee have about the same number of antioxidants, and according to the University of Scranton, coffee is also the #1 source of antioxidant for individuals. Since we talked about the benefits, let's talk about the latest concerns in coffee consumption. In 2017, an article stated, "Drink up unless you're pregnant," at risk for fractures or have Parkinson's disease. Women who are pregnant should not drink high amounts of caffeine because it can lead to stillbirth, preterm birth, and low-rate babies. Also, regular coffee may reduce a woman's chances of becoming pregnant. Women, not men, who consume more coffee are also at risk for fractures if they already had a greater likelihood. Another study found that coffee consumption for those with Parkinson's may not be as beneficial to people because they found no differences in tremors between the placebo and the caffeine. Another risk when drinking too much coffee is that it can lead to higher anxiety levels in normal individuals, but even more so in people with pre-existing anxiety disorders. The future for coffee. All in all, since coffee has been around, using its aromatic scents to coax you out of bed in the morning or for an afternoon pickup, its effects and benefits have been on an up and down slope. And all in all, there are many drinks that should be on your do not consume list, and coffee is definitely not one of them. Research is finding more health benefits every day that prove that coffee drinkers are less likely to suffer from certain diseases. Here are more recent findings. So we know that it lowers the risk of cirrhosis. 1 cup lowers the risk by 22%, and 4 cups all the way to 65%. Coffee can also lower the risk of cardiovascular diseases. 3 to 4 cups a day, there's a 19% less risk. Type 2 diabetes. 1 additional cup is a 7% reduced risk. Reduced risk for cancer. At least 3 cups a day means an 18% reduced risk. Alzheimer's, dementia, and cognitive decline. Regular coffee drinkers experience a 16% less likely risk. Lowers risk for depression with 2 to 3 cups a day at a 20% reduced risk. And then overall mortality. 3 or 4 more cups per day is a 7 to 12% less likely to die from circulatory and digestive diseases. 2 to 3 cups is also associated with an 18% decrease in early death, and decaffeinated had the same benefits. And these are my sources, and that's my presentation. Thank you.